Hi everyone, my name is Emily Maddox. I'm here today from Northwestern State University's graduate program in nursing with their acute care nurse practitioner program. I'm here today to talk to you about access to healthcare in our country, what our current options are, and why pre-existing condition coverage and high-risk pooling is important to us. In 1989, Enthoven and Chronic described our system as a paradox of excess and deprivation, and I don't think that statement has ever been truer than it is today. We have healthcare in this country that could qualify as one of the wonders of the world, some of the greatest healthcare, the most cutting-edge healthcare in the world, located mere miles away from people who have no access to healthcare at all, who die from poorly managed chronic conditions and conditions that are easily preventable. In 2015, the Kaiser Family Foundation found that 28.5 million Americans were uninsured. So why is this number important? Because Bodenheimer and Grumbach in 2012, pages 20 to 21, discussed that having no insurance means less access to care, less care, and worse outcomes. So as a practitioner, that's not a statistic that I can accept. When you view healthcare synonymously with humanitarianism and ethics, then I think that you have to advocate for as many people under our current system to be insured as possible. Our current system relies heavily on third-party payers because costs of healthcare are so high, and so people who don't have access to healthcare insurance coverage don't have access to healthcare. Under our current system, we must advocate for most people to have access to care as possible. So our current options for this are the ACA, which is Obamacare, the Affordable Care Act, or the AHCA, Trump Care, with the American Health Care Act. So today we're going to be looking at access to health care as influenced by pre-existing condition coverage and the use of high-risk pools. According to the Kaiser Family Foundation, 1 in 4 Americans aged 18 to 64 has a condition that could be considered a pre-existing condition that would exclude them from insurance coverage, although some websites have rated this number as high as 51% of Americans. So the majority of Americans, by some estimations, could be ruled out for health insurance coverage. So first we're going to talk about the ACA and how it has influenced access to care. The purpose of the ACA was to expand access to health care coverage, which it did a fair job of doing. What they did was implement a across-the-board prohibition of excluding individuals based on pre-existing condition. Pre-ACA, 52 million Americans under age 65 could be excluded, according to the Kaiser Family Foundation. So the ACA reversed this. They said you can't exclude someone from healthcare coverage based on the presence of heart disease or diabetes or cancer. You have to give everyone access to healthcare. They also said that you cannot charge significantly more or use experience rating, which we're going to talk about significantly more with Trump Care. So the ACA got rid of both of those practices in 2013, according to healthreformtracker.org, and it did increase access to health care. The other side of that is that it also increased premiums. So that's a catch-22. More people had access to health care, but they were paying more for the care that they received. The other side of this is the American Health Care Act, or Trump Care, which is a more fiscally minded, conservative approach to health care. And as someone who grew up with a picture of Ronald Reagan over my dinner table, I understand this approach, I really do. I understand wanting the most bang for your healthcare dollar. But I think that the AHCA has done this in a way that has limited access to care, and I don't find that acceptable. So the AHCA is designed to repeal and replace Obamacare, and its goal is to save money while improving access, although I don't think it has really done that. Under the the AHCA, pre-existing condition coverage is a significant issue, and despite what celebrities may have told you or what the media has told you, the AHCA at no point says, yes, it's okay to exclude people from healthcare based on pre-existing conditions. What it does say, however, is that it's okay to charge those people significantly more for their health care. So they'll be charged higher premiums and higher deductibles. Robert Pittenger, a Republican representative, was quoted on PolitiFact as saying the AHCA absolutely does not eliminate protections for pre-existing conditions. However, I don't find that statement to be completely true, because if I use high-risk pools and I charge people more for health care, if they're paying more for health care, then I'm also limiting their access. Although the MacArthur Amendment in the AHCA says that we can't limit access based on pre-existing conditions, but it does say that we can use high-risk pools. And according to the AMA, under the AHCA, people with pre-existing conditions under Trump Care would be placed into what's called high-risk pools or a risk-sharing program. So let's briefly take a look at the history of high-risk pools in the United States. According to the Kaiser Family Foundation, pre-ACA, 35 states in the Union utilized high-risk pools. What was found during that time was that people enrolled in these high-risk pools, so people enrolled with pre-existing conditions, paid premiums 150 to 200% higher than their healthier counterparts. And they also received care that was substandard or second-class care. And as practitioners, I just don't think that we can find this acceptable. We are limiting access to health care for people who need health care the most, for the sick among us, who could benefit greatly from preventative measures and from primary care. Other things that were found was that their conditions could be excluded from their coverage for 6 to 12 months. So they enroll in their high-risk pool, and if they've got CHF, then their CHF is not going to be covered for the first 6 to 12 months of enrollment. They also found that there were lifetime and annual coverage limits and capped enrollment, so that not everyone who had a pre-existing condition that applied had to be accepted. It also found that in the long run, it did not save states any money to use high-risk pools. Because of how high-risk pools and pre-existing coverage limitation limits access to health care, many organizations such as the AMA and the ACA have made public statements against Trump Care. And on the grounds of pre-existing condition coverage and use of high-risk pools, I have to agree with them. I can't support any bill that's going to so significantly limit access to health care for millions of Americans. Exclusion of pre-existing conditions and the utilization of high-risk pools limit access to health care, which, according to Bodenheimer and Grumbach in 2012, is already a significant crisis in our nation. In a system where insurance is key to health care accessibility, we must support policies that limit insurance, must not support policies that limit insurance coverage for sick individuals and make care more expensive. So I would encourage you at every opportunity to make your voice heard, to join lobbying organizations, so that our legislators know that these things are not acceptable to us, that we don't find high-risk pools acceptable, and we don't find limitation of health coverage based on pre-existing conditions as something that will benefit health care in America. Thank you so much for your time today, and it's been a pleasure talking with you.